I'm Dr. Donald Cook. That's that young face in the bottom corner next to KP and Billy Young. Keet Peng Wong, beloved husband, devoted father, dear brother, cousin, doctor extraordinaire, and friend to us all. What a distinct honor it is to be here this afternoon to share with you about this amazing man. So thank you, Janet, and Christopher, and Jocelyn, for extending me this great privilege. It does not take more than a few moments of reviewing the Facebook pages and countless blogs and videos that have been posted to capture the significant impact of KP's life here in Fort Mac. If no tributes were given today, we'd still have the testimony of countless patients and friends whose lives he has enriched. His medical work was critical and meaningful. It was also extremely long, 35 years. Thank you to all of those people who have created and posted these moving tributes to this man with respect and love. I was a family physician here in Fort Mac in August 1977 until June 1985. I had the pleasure of working with an amazing group of dedicated physicians. But KP, he was in a league of his own. I heard about KP before I ever met him. The year was 1976. I was a lowly rotating intern, that is to say, a newly minted beginner doctor, working in obstetrics and gynecology service at a well-known hospital in Montreal, Quebec. A young woman was in a terrible state. She was on our ward after a surgical procedure 2 days earlier. She was hemorrhaging and she was in very near death. There was panic in the room. All the doctors in attendance were trying to stop the bleeding and save her life. Despite multiple attempts, we failed. She'd been transfused a massive amount of blood. It looked very grim, and we were terrified because we could not save her. "Call KP Stat," someone said to the nurses. "Who's KP?" I said. Nobody answered. A few minutes passed, it felt like hours. The door suddenly burst open, and in rushes this little guy in surgical greens. Other than his eyes and his face was totally covered with a mask. He looked like the Masked Phantom, a very young Masked Phantom. He looked like he was about 15 years old. "What's going on?" he asked. He was briefed in the situation and he sat down, and in a whirlwind of speed and skill, he stopped that bleeding completely. All the docs and nurses hovering around this patient heaved a collective sigh of relief. KP got up quickly. He rushed out the door with these few words, "She's okay now." And she was. I was still in shock. I asked again, "Who was that guy, KP?" The nurses told me, "That's our junior resident, KP Wong." Wow, was all I could muster. It was a medical moment that I'll never forget. Fast forward a couple of years, late 1978, Fort McMurray, 1 McLeod Street, the Associate Medical Clinic. Dr. Billy Young, well known by many of you here today, and myself, were family doctors practicing in our busy clinic. We were in desperate need of more medical help, especially in obstetrics. The average age of the town at that time was 23 years old. And there was an epidemic of young mums and babies, and babies. In those days, it was very difficult to recruit doctors to Fort McMurray, and there was no fully certified specialist in obstetrics gynecology. One afternoon, unannounced, a man dropped into my office. He told our front office staff he was a doctor looking for work in Fort McMurray. They showed him into my office. He told me he had a wife who was an oncology nurse and that she had family in town. Further, they were thinking of moving to Fort Mac from Montreal. I asked him, where in Montreal did he train and what did he train in? He told me Obs and Gynae in Montreal. Where in Montreal, I asked. And he proceeded to list the hospitals that he'd worked in. By this time, he was looking strangely familiar, as was his short answers. I finally asked him his name. He replies, KP Wong. I was stunned. KP Wong? You're KP Wong? He responded, yeah. I nearly fell out of my chair. I jumped up and I shook his hand, mumbling, KP, you sit right there. I'm going to talk to my associate. I ran up to Billy's office and interrupted him with his patient. I said, you won't believe our luck. KP Wong is in my office, looking for work. I gave Billy a brief rundown on KP's excellence and told Bill, we need to sign KP right now before he changes his mind or goes back to Montreal. Fortunately, Billy was easy to convince and instantly saw the great value of having a fully and recently certified specialist trained in Montreal join us in the Associate Medical Clinic in Fort McMurray. KP's job interview was the shortest interview of any medical candidate I've interviewed in my 37 years career. It remains one of the best decisions I've ever made. That was the beginning of KP's McMurray years. However, the road to practice in McMurray was not easy. Shortly before KP and Janet moved to Fort Mac from Montreal, he was diagnosed with an extremely rare cancer. KP had a significant tumor on his arm, and he underwent surgery and began chemotherapy, which was completed in Fort McMurray. I personally administered those potent drugs to KP in our clinic after hours. I can attest to the fact that throughout it all, he never complained. He was one of the toughest and most stoic guys I have ever met. He remained optimistic and good-humored throughout his ordeal. Indeed, he insisted on working in spite of all the side effects. He was a trooper. I never heard KP bring up his medical situation for sympathy's sake or special treatment, when both would have been understandable. KP had the astrological sign of a rooster. I understand Chris and Chris's grandpa did too. This is the only rooster family that has a heart of a lion. Praise the Lord, KP fully recovered from that, and amazingly had no recurrence of that wicked arm cancer. Miracle of miracles, a few short years later, Janet and KP had their two wonderful children, Chris and Dawson. I never thought that was going to be possible with what we gave him. KP and Janet, they're modern day pioneers. They're among the most courageous and strongest people I have ever met. Whatever they do, they put their whole hearts into it. They have sincere and humble hearts. From the day KP came to McMurray, the city's obstetrics and gynecological care was transformed overnight. This turning point was medically dramatic. Now, for the first time, Fort McMurray enjoyed world-class, big city complex and comprehensive obstetrical and gynecological care. A short list of his accomplishments that revolutionized medical care in McMurray includes: KP was the first fully certified obstetrician and gynecologist in Fort Mac's history. KP set up the first fetal monitoring unit, both external and internal, trained all the obstetrical nurses on how to use this complex machinery and interpret this data. KP bought his own ultrasound machine and was, to my knowledge, the first obstetrician gynecologist specialized in Alberta who was fully certified in office and bedside ultrasound. KP vastly ramped up the advanced laparoscopic minimally invasive surgeries, sparing women major laparotomies. KP managed high-risk pregnancies that prior to his arrival would have had to be delivered in Edmonton. KP's C-sections and surgical skills, as John Teen can attest, were outstanding, with great outcomes for moms and babies. He was amazingly skilled with forceps. KP did infertility work in tubal reanastomosis. I can still see him with his operating microscope glasses perched on the top of his head like night vision goggles in the OR. KP could have rested more, but he was dogged in keeping up and abreast of the latest advanced technologies in obs-gynae and attended medical updates regularly, and was always on the learning curve. And by the way, he was always on the teaching curve. And he benefited all of his patients and all of us colleagues who was working with him. The workload in McMurray, as some of these physicians who are here now can attest to, was punishing. The call schedule was grueling. Even though KP was a specialist, he worked in the emergency department on call doing family practice as well. No special privileges for him in spite of a baby or two a day to deliver. KP kept up. I've never seen any fully certified obstetrician and gynecologist anywhere before or since, anywhere in the country, whoever did primary care in the emergency department while they were on call for obstetrics and gynecology. Eventually, our manpower improved, and once again we pulled him off of that roster finally. But there were no complaints for KP, he just did it. The three of us, KP, Billy, and myself, worked side by side, day in and day out. So did the Tings and everyone else, other physicians of those times. Billy would help KP with the high-risk surgeries. KP would do the surgeries, high-risk forceps. I did the anesthesia. We all had full practices. Each of us delivered babies, cared for hospital patients, worked in the emergency room as emergency room physicians, and we rounded on our patients 7 days a week. The only breaks we had were vacations or medical conferences, squeezed into our tight schedules, so our partners wouldn't be left too long without help. There never seemed to be enough time, always 24/7, relentless demands. You get to know someone really well in those circumstances, and what I learned from KP Wong was invaluable. It was so helpful to have a mentor on the field of obstetrics and gynecology. Many a day I walked up and down those stairs in the clinic asking for his medical advice. Not once did I sense any arrogance or pride, just an eagerness to pass on his considerable knowledge and expertise. So many nights I called him, 2 in the morning, 4:30 in the morning, 6:30 in the morning, same night, for one disaster after another of high-risk problems. He never got irritable, cranky, or complaining. He just got up from bed, came down to help, whether it was minus 40 degrees or not. It made working with him an endless inspiration and a pleasure. KP was strong-willed. He was determined, and he held powerful convictions. Many times we had interesting discussions over a quick lunch at Smitty's before returning to work. The Bible says, there is a friend who sticks closer than a brother. For me, that man is KP Wong. I'd rather have KP at my back than any man triple his size. There were many times at McMurray when things got hot with medical politics, but KP was not one to be bullied. He had strong convictions about what was right and best for his patients, and that is what he'd do. The word that best fits here is integrity. He was loaded with it. Have I mentioned his generosity? He was. One small personal incident that showcased the quality was when I was in my residency and my funds were low. KP graciously and without fanfare paid a legal bill of mine. He would not accept repayment and sloughed it off with a shrug. Vintage KP. The medical lifestyle often exacts a high cost on the wives or husbands or families of doctors. And I'd be remiss if I didn't mention that debt of gratitude. A debt of gratitude is owed to Janet for her patience and her perseverance. While KP was giving his best to his patients for 35 years, our gratitude is also extended to Chris and Jocelyn, who waited for their father so many nights and weekends, while KP was helping someone else or helping us help someone else. Thank you, Janet. You enabled this town to have the very best obstetrical care and gynecological care at great personal expense and sacrifice. It does not go unnoticed. And of course, our thanks go to Chris and Jocelyn. It's been estimated that KP delivered 20,000 babies in his blisteringly busy career. That's about 1 in 3 of the McMurray population within McMurray. Today, it could be said, KP is a modern-day Father Abraham, and was indeed the father of many nations. My 8 years in McMurray were formative and foundational as a physician. When I left to specialize in internal medicine in Vancouver in 1985, I left a medical practice, but even more, I left friends, and I left my friend. Whenever we got together after that, regardless of the time that had passed, KP and I'd sit down and pick up where we left off. It is as if there was no time passed at all. What a testament to the kind of man he was. It's ironic how life turns out for many a doc. You spend a medical lifetime trying to save people's lives and better their day-to-day living. And yet, in the end, you succumb to a medical tragedy that no doctor can help or heal or repair. Try as they might, there's nothing more anyone can do. For 29 years after KP's initial cancer treatments, he lived cancer-free. Healed in the true sense of the word. He lived fully and did not waste a moment in life. At the beginning of this year, when he was diagnosed with yet another, different rare cancers, these were totally unrelated to his past medical issues. Nothing had changed in his attitude or his approach to managing a devastating diagnosis. He would fight again. He would not be self-pitying or complain. All the qualities I saw in KP fighting his first cancer were still there. He was stoic and tough. The heart of a lion remained. But this time, it was different. An even more grievous medical situation was discovered. Not only was he fighting these new cancers, but had additional and substantial cardiac complications. It was painful to visit and see him in obvious distress, but not a word of complaint came from him. He was terribly compromised medically, but gracious in receiving his old friend. I will cherish these visits forever. This time, a physical healing was not to be. He fought valiantly to the end. But it was as if the heart of this warrior simply gave up. He'd given his all to everyone else, and there was nothing left over for himself. God took KP home. At the end of one's life, if you have faith in God, a loving and devoted family, and a handful of friends who are loyal and true, you can consider yourself blessed. KP had all of these in abundance. So this is not goodbye, KP, but rather, I'll see you again, my brother, in heaven.